Training and assessing the Fundal Red Reflex, workshop planning and delivery ideas. This video describes some ideas on how best to deliver a workshop on the reflex test. You will need enough trained trainers for the size of the group, a well-ventilated room that is large enough to comfortably teach the group, a means to make the room dim enough to be able to perform the examination, a table large enough for all the participants to stand or sit around, posters that demonstrate how to perform the test and that illustrate the appearance of the test, teaching cards with similar illustrations for the participants to make notes on and take away with them as a record of the training, videos that illustrate how to perform and interpret the reflex test, 3 simulation eyes for each participant that mimic normal and abnormal reflex findings for training and assessment. If possible, it is helpful if they can take the eyes away with them after the workshop to practice on. And finally, charged Arclights, as many as there are participants, so that everyone can take a device away at the end of the session. The number of trainers needed is determined by the number of participants, their professional background and their previous experience in eye care. To deliver a successful workshop, typically a minimum of 1 trainer for every 10 participants is recommended. Start the workshop by handing out Arclights to everyone. Demonstrate how the Arclight works, which button is used to switch it on, toggle through modes and cycle through the different lights. Be clear about which end is used to examine the external eye and which is used for the reflex test. There is a video that can be used to emphasize your own demonstration of how the Arclight works. Ask 2 or 3 participants which end is used for what examination to check they understand. Make sure everyone sets up their Arclight so that the direct ophthalmoscope end comes on first by pressing the grey button for 15 seconds, then clicking again quickly to move through the modes. Next, explain the technique for performing the reflex test. Demonstrate on a participant. Then ask them to demonstrate on you. Show the poster to emphasize the key steps to the technique, which includes dim the room, examine at arm's length, use the brightest light on the direct ophthalmoscope end of the Arclight, lens rack at the top where there is no lens, hold close to examiner's eye, observe both eyes at the same time, compare brightness and colour. Now turn the lights down in the room and get participants into pairs and ask them to examine each other. Observe everyone. Move amongst the group, checking their technique is correct, considering the checklist of examine at arm's length, use the brightest light on the ophthalmoscope end of the Arclight, lens rack at the top where there is no lens, hold closer to the examiner's eye. Keep reminding everyone of this list, making sure they are using the correct technique. After a few minutes, turn the lights back on and go over the technique again using the atoms cards, posters and video. Ask the participants if they have any questions. Consider giving the group a short break now. The next part of the workshop will use simulation eyes to mimic pathology. Show some of them how to take the lid off and empty out the contents. Then take them through how to make a normal eye, then cataract and retinoblastoma. There is a video that illustrates how to do this. Give the participants 2 or 3 eyes each, then ask them to make up normal, cataract and retinoblastoma eyes in equal proportions. This should only take 5 to 10 minutes. Once the eyes are made up, demonstrate to the group how to perform the reflex test on pairs of eyes, choosing a range of combinations of pairings. Allow participants to practice the reflex examination using the simulation eyes for 5 to 10 minutes. Observe participants' technique and check if they are able to correctly describe the signs depicted in the eyes and suggest a relevant clinical cause. At the end of the session, set up a short assessment using numbered pairs of eyes. Ask participants to examine the pairs of eyes, writing down on a piece of paper their findings for each eye, right and left. Then go through the answers with them. This short assessment will identify those who need some more time to get the technique correct and understand how to interpret what they see. Ask their peers who did well in the test to support them. By this stage, the participant should be happy how to use the Arclight to perform the reflex test and know what normal and abnormal appearances look like. This is now a good time to demonstrate how to attach the Arclight to the camera of a mobile phone to capture video of reflexes. Carefully show how to accurately place the sticky clip with the pointer directly over the lens of the camera that is used for video. Once the clip is accurately placed, explain how to attach the Arclight with a sight hole over the centre of the correct lens. Record some examinations on participants and simulation eyes to demonstrate how this might be used for education and second opinions. After this final assessment, ask if anyone else has any more questions, then conclude the workshop.